NHIF managers in Nairobi and Meru, and why patients have been discharged despite being in need of service. At least 8 hospitals have been closed after being accused of minting money from Kenyans with support from employees at NHIF. The health CS is also expected to respond to the current management structure at NHIF and the recurrent process, which is faced with multiple scandals. We now cross over live and touch base with our reporter Brenda Zeda-Radido, who has been following up on this story that is developing now. Brenda Zeda, good afternoon. What do you have for us today?
To an end, the CS, that is Susan Nakhumicha, CS for Health, appeared before the National Assembly Health Committee that is probing two important issues here in the country. That is the suspension that happened of the top managers at the NHIF and also the KEMSA mosquito scandal that saw the sacking of PS Josephine Boru and suspended CEO rather for KEMSA, that is Terry Ramadhani, and the chair, that is Runo, the chair for KEMSA. But then let me just begin with that introduction that you've given our viewers when it comes to that NHIF, the suspension of some senior managers. And the CS told the committee that this is a matter still investigations and thanked the media, one of the local media houses, for bringing that out to let Kenyans know what is happening to their transaction when it comes to deductions that are, dubious deductions that are being made out of their NHIF contribution from their cards. And she didn't give a lot of details about it, but just assured the committee that this is matter still under investigations and will give a comprehensive report tomorrow, because tomorrow the CS is still expected to appear before that committee when it comes to shedding more light on that NHIF, if I may say, so scandal. But she also told the committee, confirmed to the committee, that several health facilities have been closed down, saying that these health facilities were even the health facilities in question were conducting surgeries, many surgeries, more than even the Kenyatta National Hospital or even Eldoret Hospital or even the Kenyatta University Hospital. But then of today, what caught the attention of the health committee members away from that NHIF is the KEMSA scandal. And of course, Aseto, I've been reporting on this, following up on this KEMSA story, and so far we saw that it has been a blame game between the Ministry of Health and also the Ministry of Health and KEMSA on who bungled this entire thing. But it is now coming out clear during today's session. It came out clear that bungling of that multi-billion shillings tender actually happened at the Ministry of Health. This is after the former director of preventive health, that is the current acting CEO, Andrew Mulwa, said that he was advised by an unforeseen person at the ministry telling him that, there's something that is missing, a specification of a PBO that was not needed by Global Fund that needed to be included. And so these are just some of the issues that cropped up during today's hearing by the National Assembly Health Committee. And of course, also just remind our viewers as I hand it over to you that it is not only the National Health Committee that is probing this KEMSA scandal. We also have the Senate Health Committee that is probing this scandal. But of course, we assure our viewers that during a subsequent bulletin, we shall be giving them an in-depth information concerning what transpired today before the National Assembly Health Committee, but not the Senate, but the National Assembly Health Committee.